welcome to another episode of inspirED. I'm Sarah Loudon from Total Health Conferencing, and tonight's episode is on back to school. So as we're all living in this time of a global pandemic and facing or have recently faced decisions about sending our children back to school, we decided that this would be a timely topic to pull the experts, and truly the experts, not like your Facebook friends that all seem to have an opinion that they can't wait to post, but truly the experts in medicine to discuss how they are making decisions, as well as how they're parenting through this time, which, you know, it poses challenges of its own. So rather than introduce each one of the panel, I'm actually going to ask each one of you to introduce yourself and maybe add on your children and your children's ages. So also, in the interest of the fact that this is a friendly conversation, I do ask your permission to call you all by your first names, not, of course, for any disrespect, but just so that the listening audience can feel much more at home. So looking at gender equality, we're going to start with Manish first tonight and have him introduce himself, please.
Sure. I'm Manish Shah. I'm a physician in Wesley Chapel, Florida, just a little bit north of Tampa. I have two daughters, a 16-year-old and a 14-year-old. One just started high school and the other one's a junior now. So kind of living through this pandemic like everybody else, trying to figure out what the right choices are. But here we are.
Thank you. Thank you for joining us. Heloisa, I'll go to you.
Hi, Heloisa Soares. I am a GI medical oncologist at Huntsman Cancer Institute at University of Utah, and I am the mom of Bella, who is 6 years old and is now in first grade, and Nico, who is 1.5 years old. Thank you for having me.
Thank you. Christina?
So I'm Kristina Mirabeau Beale. I'm a radiation oncologist with 21st Century Oncology in Fort Myers, Florida. And I'm also in our breast program leadership at our regional cancer center. And I'm also mom to twin boys, Alex and Drew, who just started kindergarten a few weeks ago.
Oh, wonderful. What a great age. Jane?
Sure. I'm Jane Meisel. I'm a breast and GYN medical oncologist at Emory University in Atlanta. And I'm the mother of Jack, who's 8, and Josh, who's 5. So 3rd grade and kindergarten.
Thank you. And Roohi?
Hi, I'm Roohi Ismail Khan, and I'm a medical oncologist at Moffitt Cancer Center in Tampa. I serve as the co-director of cardio-oncology and a medical oncologist in the women's oncology program. I have 4 kids, and the youngest one is just starting middle school. She's starting 6th grade. She's 11. Her name is Lyra, and then Afraz, sorry, I'm losing count. Afraz, and he's going to be a sophomore in high school. And Azim, he's going to be starting his sophomore year in college, and Ziba, a junior year in college, and they're both here locally in Tampa.
Wonderful, thank you. And just for the audience, I have a 16-year-old. I'm sorry, I have a 17-year-old. I
forgot that. Yeah.
Isaac, and a 6-year-old Joseph. Again, very different circumstances. So, you know, I want to make sure that as we're having these conversations, there is no right decision. I really believe that. I believe that, you know, you're listening right now. We are making decisions based on what we think, based on our own particular circumstances, based on what we can collect about where we're all living. So what might be happening in Tampa or Atlanta or Utah may not be happening in South Florida. And so for the audience, you know, so much of this time is about releasing any judgment for what decisions you and your family are making, because there is no rule book about this. So I want to start by saying, even though this is a panel of experts, their expert opinion has to be matched with the fact that they are the parents of these little ones, and each person has a different level of risk that they're willing to accept. And I think the panel would agree with me that as we continue to talk, we're all talking from our hearts, and we're trying to infuse that with what we know from science about this particular virus. So having said that, Manish, I'm going to start with you because you're probably closest to this in terms of your, daily activity. what are you saying to parents who are asking, what do we do?
Yeah, that's always a tough and challenging question, just because every situation is a little bit different, and being mindful of the situation that you're in is usually what's going to be most helpful in determining what your advice to your parents are going to be. And I think the risk factors that the child may have, the risk factors that other members of the family may have, risk factors of extended family that frequently visit the home, also play a role in your decision-making process. Case in point, my brother's a pulmonary critical care doctor. He's got 3 children. He's around COVID patients literally every day. His in-laws live with him. His father-in-law has severe coronary artery disease, and his mother-in-law is not in the best medical condition. So he has risk factors at home that live with him. He unfortunately developed the virus. All of his children actually developed the virus and have antibodies. So they are actually going back to school, which they probably wouldn't have they not been exposed to the virus already. So I think the challenges are for families with some members with underlying disorders. I think those are difficult discussions to have. I know the schools mean well by ensuring social distancing, making sure everybody's got their mask on, making sure that everybody's using their hand sanitizer, washing their hands, and doing everything that they can to be as safe as possible. But in the end, it takes one exposure, unfortunately, to pass along this virus, and that must factor into the equation if you have people that are unfortunately at risk for this virus, and that's always a challenging discussion to have. I think for otherwise healthy family members where there isn't a lot of worry about exposing somebody who's high risk, I think that discussion is a lot simpler. Then you say, hey, I think probably the data is sufficient to say go back to school, wear the mask, as long as the school's got the appropriate situations and procedures and policies in place, then you're good to go. You should go back to school. I think, for my 2 daughters, they're 14 and 16. We don't have a lot of risk factors in our homes, so they're both back in school. And we tell them, hey, look, keep the mask on, wash your hands, do your best at preventing this virus, and they are. So I think that's, again, a longer explanation for a not very innocent question, but I think each one of them, each situation is going to demand its own thought and then response.
Yeah, well, I appreciate that it isn't a one size fits all, and that even within those categories of people who may be at higher risk, their tolerance for risk might be greater based on numbers in their community and based on the way they're balancing their family. So even in that sense, it still isn't a one size fits all. Jane, I'm going to go to you because your boys, first of all, they're 2 of the most amazing kids I've ever observed and met in my life. They have the personalities of future kings. I mean, they're incredible. And they're 8 and 5. This is a major thing because different than Manish's kids, where you can give very clear direction, use your mask, wash your hands, stay 6 feet apart. If anybody's engaging in risky behavior, walk away. How would you say that to your boys? And so I want to start with, what has been your decision in terms of sending them back to school? And then how are you communicating one way or the other about risk mitigation at their age?
Yeah, it's challenging for sure. I think our 8-year-old understands better than our 5-year-old, but the 5-year-old's also been pretty good about it, just because I think, really since the beginning, since schools closed down here, March 13th was their last day of face-to-face school before we broke out for the summer. And they understood that something weird was going on. And so we've talked a lot about coronavirus. We've read them kids' books about coronavirus. We've talked to them a little bit about masks and about the importance of masks and how when you wear it, you're not just protecting yourself, you're protecting other people. And it's a good deed. And they've seen that really everywhere we go, whenever we go places, they have to wear one. So they've been okay about it. It's actually been interesting. Our school has not opened. So they are currently in virtual kindergarten and third grade. They've been in school now for about a week and a half. And the school, they go to private school, but it's actually one of the only private schools in Atlanta that has not opened yet. They've taken a very conservative approach. Carlos Del Rio, who's kind of a national figure in infectious disease, is a parent at our school and has been heavily advising the school about, what to do and where the numbers are in Georgia. And they have not felt safe opening yet. So we have not opened. And I have mixed feelings about it. In some ways it was nice not to have to make a decision, because as an oncologist also, I feel like with a lot of young female patients, lots of my patients have been asking, my opinion on what they should do and about what I'm doing. And I think because it's a tough balance, it was sort of nice it's been sort of nice not to have to say, here's what I'm doing, here's what I chose to do. Although I would say, and I've said openly to people, that I think when our school does open, because the plan they've put in place that they've sent out to parents about the potential opening for later in September seems very sound. And we don't have a lot of high risk people in our household. It's just the two boys and us. And I feel like particularly in elementary school, there's the academic side, but then there's so much socialization that is just really hard to replicate virtually, that we will send them back when it's time to go back. And I think the school has a good plan for it. So I feel confident about that. But the masks, will be a big thing. The hand washing is a huge thing. But I think, like almost any other decision we make in medicine or in parenting, frankly, it's kind of risks versus benefits. And I think in our situation with the particular school that we are at and the way that they say they're going to be doing things, and I have complete faith in them, I think our decision will be to send them back to school.
Yeah.
But you're right. It's not an easy decision for anybody.
Yeah. Christina, kind of same question in terms of your twin boys. How do you socialize them to the point where they're away from you? I mean, I know with Joseph, who's 6, he will do everything. If I say to him, remind him, put on your mask, don't forget, no questions. He doesn't fight it, nothing. But outside of my eyes, I don't know what he would do. So what are you thinking with your boys in terms of messaging the importance of this? And then what was your ultimate decision, if you've made one?
So I guess it's kind of similar to Jane's situation with her boys. Mine were kind of out of their preschool kind of mid-March. And really since then, my husband's also a physician. They've kind of watched mommy and daddy go to work and our protocols change. So they're very comfortable with the idea of seeing us, wear masks. And then when we come home, you can't touch us. We have like our decontamination station where we strip down, then shower before we're even, allowed to really touch, interact. So they were kind of getting accustomed to seeing that. And we're pretty transparent that, this is, we similarly got good children's books and watched YouTube videos that kind of broke it down to a childlike level. So they understand kind of some of why reality around them has shifted so much. Our preschool at the time, Zoom preschool was just kind of a disaster. I mean, I think for at least my 5-year-old boys, and maybe it's also because it also brought up some logistics, right? Were we going to get 2 computer screens for 2 different 5-year-olds to Zoom into a session to talk about colors? I mean, it was very, very challenging. And I think that, definitely the socialization piece is what really matters, I think, at some level, more so for kids who are kind of under the age of 8. My boys are younger, summer birthdays, so arguably even if there weren't a pandemic, I think there's a lot of stress sometimes about summer birthday kids. Do you hold them back or not, just for more maturity? We had thought about that even before the pandemic, and then that added another layer of an excuse of okay, well, we have another reason we could keep them home. But then as it just got, month by month, just kind of watching them interact with each other, we actually have a decent setup in terms of my mom helping with childcare, and we also have a part-time nanny. My husband and I juggling kind of shifts to try to keep them engaged. I think ultimately we just saw that they were lacking for something. The private school that ultimately we were planning on putting them in for elementary school released their plan, and kind of similarly has a lot of local infectious disease folks kind of involved in the planning. And ultimately we felt kind of safe with both the fact that it was small class size, they were able to restructure the classrooms to do adequate distancing, and then just kind of, behaviorally, my boys were kind of on board with wearing masks, and I trust them more than I probably should as an average 5-year-old. They even wear masks sometimes watching TV because they think they're ninjas, and you kind of made it a game. So, now we're 3 weeks in, and they actually do a pretty good job. it brings up a lot of emotions, even as a parent, things like drop off now, like there aren't any parents allowed on the campus. The teachers greet the students, you know, with masks on, hand hygiene, and then they just ushered in. And in a sense, even that was kind of challenging as it would have, I mean, sending your kids off to kindergarten is a big milestone for parents in general. And then this just added another layer of complexity. But I think we've been pleased with the open communication we've had with the school, the fact that they seemed kind of less political and more willing to kind of just pivot with the numbers and be very data driven. And then the fact that both my husband and I are honestly, you know, we're healthcare workers, and we had looked at some of the data around kind of, you know, essential healthcare worker childcare situations that show that, you know, a lot of kids were doing okay. So I mean, I don't know, that's a similarly long-winded answer. I don't know if that's our rationalizing kind of what we ultimately chose, but we ended up making the decision that we're a relatively low-risk family, and, you know, a lot of children seem to do okay. And I think our boys were just bursting at the seams to like get more interaction, and we weren't able to really keep them occupied. So they're in person school, and so far so good.
Well, thank you for sharing that. And I mean, even the length of the explanation, it speaks to the psyche of the parent making these decisions, because it's kind of this in your head, this battle with, you know, what are you doing? And so I completely can understand it. Okay, I'm going to shift a little bit to higher risk homes. I have an autoimmune disease. I'm at the beginning of this, I was terrified. When I tell you I wasn't leaving the house, no one was leaving this house. My husband, my kids, I mean, I was thinking, do I spray down the mail? Do I spray down the groceries? I was like one of those people thinking, you know, if I get this, I'm gonna die. And so of course we've learned a lot since then, but I keep describing this to people as it's almost like post-traumatic stress, where you know the data is giving you more freedom to make rational, safe decisions. But that fear is like, but what if something happens? Will I say it was worth the date night? It was worth having, you know, my sister over. Like, that's always the thing in the back of my mind. So I want to switch to Roohi and Heloisa, who both have higher risk environments, and ask, Heloisa, I'll start with you. What decision have you made, and what decisions led up to that based on your own environment? Oh, can I have you on mute? I decided I was going to get a shirt that says you're on mute so that I just like pull it up.
I apologize. Yeah, so to me has been really evolving decision making. So I can tell you that when COVID was hitting, I was in the hospital myself with a new diagnosis, and figured out that I'll have to be on immunosuppression medication, potentially for life. And it was very confusing because I didn't know what to do in terms of my own work, in terms of to do of the kids, and so forth. So we took the kids away from school March and most of April. I decided that for me to continue to see my patients and not, you know, be in fear all the time of getting COVID-19, that I was going to delay starting my immunosuppressive treatment. And as things evolve and as we learn more and as the numbers, you know, Utah took a little bit of time to get to the peak, which was probably around May and June. And now things are getting better, thankfully, here. We became a little bit more liberal in terms of what to do. So in the first month, I literally, other than coming to work and trying to respect social distancing, physical distance as much as I could, I wouldn't get out of the house for anything. Everything was delivered to the house, and my husband would be wiping every single, you know, grocery store package and things like that. But then when we started knowing more, I allowed Nico, which is the younger, to go back to daycare. And now Bella started the first grade because they have very reasonable safety measures in place, and she's being a trooper in terms of respecting that. I also taking and extrapolating from the data from Europe, I felt it was safe for me to start my own medications. I waited for expert society's opinions about my own disease, and felt it was safe. So now I am on my medications, and I'm seeing my patients, and obviously respecting social physical distancing as much as possible when appropriate, with patient care.
Thank you. Thank you for that. I actually didn't know that you made the decision to delay. I actually struggled with my own decision whether I should stay on my biologic early on. And I had a very deep conversation with my rheumatologist, who said, other than the fact that she knew me and knew my background, she wouldn't have gone into all of this, but actually said that for patients on biologics, the nature of the medicine is that, yes, we'll always be more susceptible to getting sick and getting COVID-19, but that the mechanism of action of the medicine actually would help us in terms of that cytokine storm reaction that really is responsible for what, kind of ultimately. Yeah. So that was really, I think, again, it was like early on, no one knew. And so you just were making all of these decisions from fear. But as we've kind of learned more, we now can, be more measured in our decision making.
Yeah. And now, sir, I think it's not only about, it wasn't all about me, because actually my husband got upset with me on that, but I felt that we didn't know what was coming. And I was like, I might need your help in the hospital with the awards, and I don't want to be afraid. So I talked to my physician, and I said, do I lose a lot in waiting? Because I wanted to be able to be available if needed. And that, that's, everybody's different. It is a different conversation, but our loved ones felt that.
How long did you wait? I'm sorry. How long did you wait?
I started in June. So I waited 3 months.
Wow.
Yeah. It's really, Heloisa, it just speaks to, all of you. It speaks to the fact that, you go into medicine for a reason, and you think it's, all of this kind of like, okay, it's building the structure of what I want. And then something like this happens where oncologists, radiation oncologists, pediatricians are all being asked to do things that are well out of the scope of what you kind of, if you want to say, signed up for. And without hesitation, all of you jumped right in. And I mean, Heloisa, to think that part of the decision was you didn't want to not be able to help. I mean, it just speaks volumes to the fact that you all really are incredible. When we use the term hero, it really does. It has a meaning that goes beyond, anything that's a hashtag related. Roohi, I want to get to you because you don't have, at least as far as I know, you don't have an environment, personally, where you're afflicted with anything that would cause you to be higher risk, but your household does. So maybe tell us a little bit about the decision making, what you ultimately decided to do with the kids, and then how you made these decisions, even in staying in clinic during this time because of the circumstances.
Yes, Sarah, I have to tell you, there was like 2 Roohis, and they were arguing with each other. So I, as you all know, my husband's in a wheelchair, and he has bilateral atelectasis from being in a coma for a month, and he gets respiratory illnesses quite easily. So the fact, the idea of him getting sick with COVID, obviously I would do anything to prevent that. So, during this time, my daughter was graduating from 5th grade when school closed, and she was starting middle school. And I had put in my name for a lottery to get into a really good charter school for her for 6th, 7th, and 8th grade. And I got in. I was so excited. And then and my son, he was going from 9th to 10th grade. So when everything shut down, all 4 kids came home in March and towards the middle of March. And I had decided then that I'm never going to send them to school until we have a vaccine. Okay. I told them, okay, we're going to go homeschool until there's a vaccine. You're not going. And they looked at me like I was in a job. Okay. My older too. They looked at me like, Mom, what's the college experience if I'm going to be sitting at home all day? And what kind of college experience is this? And I understood it. But then when we talked about their dad, and they all got it, they said, okay, all right, we'll do everything and anything, whatever you want me to do, we'll do it. And then I became a little bit of a case where I was doing this similarly what you were doing, Sarah, wiping things down, Lysoling things. And when I went to work, I looked like an alien. I wore a mask, a face shield, a hat, and I just wanted to make sure that and then I created my laundry room door into like a sanitation unit. So I would drop off the scrubs and then wash my hands and go straight to the shower. And then I came in, and my kids didn't go anywhere, just the backyard, and, you know, played basketball. And in fact, I sort of prohibited my dad from coming over too. And it felt really bad. So I hadn't hugged my father in so long, and neither had the kids. So it's been a while. And then to hot it all up, my sister-in-law got COVID. And Manish, she's your patient. she got COVID. I don't think you know her that, but Ayan's mom got COVID. And she's—
I had no idea.
Yeah, and she's the one who never goes out of the house. She's a homemaker. She stays home. And her husband, who's a vascular surgeon, my brother, brought it in and was completely asymptomatic. Okay. And she has an autoimmune issue as well. And so she got sick, and she ended up, her oxygen stats dropped to 70s. And my brother never had anything more than a sore throat. So I was very, very, very concerned, obviously. And this made me even more set in my ways that I'm not going to send my kids to school. All right. So come around the summer and everything, and my kids, thankfully I didn't have to make a decision for USF, because USF went online. That's the university. It went online. Even now, my two older kids are online. They were supposed to do labs, like they're both pre-med, so they were supposed to do lab on small groups on campus with masks on. So I was like, okay, I guess we can do that. But even then, like right now, she's in a lab online. So they created that virtually. Okay. So I don't have to worry about, I'm so glad I didn't have to make that decision, because that was made for me. And I was a bit nervous because it is a very crowded campus. As for my younger two, I think I've changed my mind 5 times. And I'm telling you, there's 2 of us. Therefore, we're arguing against each other. Let's go with my third kid, Afraz. He's going to 10th grade, and he's in the IB program, which is really hard. And he was like, Mom, I can't do this. I didn't do well my last quarter because it was too hard to keep up with all the stuff. And it's really, really hard. I don't want to be on, I want to go to school. And so we're like, okay, well, let's go and see your school. We'll put on the mask and we'll talk to your teachers. We'll go to see your school. And I went to his school, and I was not satisfied with the precautions they took. They did not make enough precautions. There was not enough for me to feel satisfied that this, so I decided he's going to do online school, and much to his displeasure, he's doing online school. My youngest kid, who really took a big hit academically when it went online, because she's a very social kid. She needs social interaction. And I'm like, well, let's go and check out your school. And I have to say, this school has, most of us who send our kids to the school are all physicians at USF and Moffitt. And so they have a really good advisory board. So similar to what Jane said, a lot of the ID doctors are part of the advisory board. And I was so happy with what this school has done. So I shouldn't say names, but so this school has really gone above and beyond. They've encouraged their 8th graders to stay home online. Their 6th graders to come to school. And the 7th grader, they've asked to make that decision. So they have less people in school. The 8th graders, since they've been in school for 2 years, they're like, well, you're mature enough to do online. And you 7th graders, you can choose. You know, your parents can choose. You 6th grader, we really want you to come, but if you can't, it's okay, we'll do online. There'll be a Zoom, you can Zoom into the class while it's happening live. So we went in, and everything's 10 feet apart. All desks are 10 feet apart. There's, they're not eating in the cafeteria. They're doing everything like they're doing. So there's so many precautions being made that I felt comfortable. And my daughter's been in school for a week. Masks, they're wearing strict wet masks, and I'm actually quite reassured. Of course, as soon as she comes in, she feels like she has a plague because I make her go straight to the shower, and then she, you know, daddy. But that's my decision, and I think I made changes in those decisions 3 or 4 times until I came to those decisions. To layer all this, my husband has therapists. So when all this happened, I quit. I also serve as a medical director, the acting medical director for his therapy center, Same Step. So when they asked me, what do we do? I said, close the center. So we closed the center. We did not go to Stay in Step for at least a month and a half. And then when things started opening up again, then I required that each therapist change scrubs between each patient, that they change entire outfits between each patient. And they're very, very strict now. And they can, instead of having 4 clients in the center, they can only have 2 clients in the center at the same time. And so they're on 2 different sides of the building. And even after all those precautions, I found out that one of the therapists had COVID. They got symptomatic and had COVID. And I got Nadim tested and he was negative. So he was wearing mask and the trainer was wearing mask and a face shield. So, that sort of reassured me that as long as we're taking precautions, even if he did have COVID, because both people were wearing masks, my husband was wearing a mask and he was wearing a mask and a shield, and Nadim was safe,
Yes.
So, we're doing the best we can in the situation. We're taking extra precautions. 1 out of 4 children are going to school, but the school is really, really taking it seriously. So that's why.
It's great to hear how not only was it a blanket, but individual decision. It was an individual decision based on each kid. And based on what the kids needed and based on what the schools were providing.
What the school did, yeah.
So, I mean, it's certainly, again, it just speaks to the complexity of these decisions. And I also want to note for the listeners, you are all doctors. So you're all making these decisions with like the highest levels of evidence available. You got to think about that single mom or single dad who doesn't have a great support structure, who has, 3 kids under the age of 15, all in different schools, who has to make decisions, maybe even despite their level of feeling that the school is prepared or that their child needs it, because they've got to work. And so add on to that they're being bombarded with all these mixed messages from all these media outlets, social,
and the politicization of all this. It's
right. I mean, it's when you really think about the layers of kind of the American society and how we're making these decisions, it's almost impossible. Manish, I want to take the conversation back to you because I kind of want you to just speak to us in terms of childhood transmission. So let's kind of take all the stuff we think we know about data in terms of risk outside and say, what do we know about the way children are exposed, receive, and transmit this virus?
So I think, unfortunately, we have a lot of data, and unfortunately, all the data, when you comb through it a little bit better and comb through it again and comb through it again, unfortunately, certain things reveal themselves. Kids can transmit the virus to other kids. That's not actually a debate. It actually does happen. They can transmit to parents. They may have higher levels of the virus inside their noses, so they may actually carry around more virus than a comparable adult. The question really becomes, how much of that is actually truly infectious and how long is it infectious for? They've demonstrated that some people can shed the virus for weeks or months after diagnosis. And one of the first cases, the person was still shedding virus from his nose, an adult, for 3 months. We suspect that that's the same for some children as well. The question is how effective that is, and that's a little bit more difficult to answer. I think we're writing the book as we speak for this virus. Other things, we know a lot about chickenpox, we know a lot about polio, we know a lot about all these other diseases. Unfortunately, we've had hundreds or decades of time to write those books. And literally this virus is so brand new that becomes a challenge. But children can pass it to children, they can pass it to adults. And unfortunately, that is something that you have to consider for this virus. I'm sorry, you're gonna have to give me the 3 parts of the question. I got one. So,
how they receive it, how they transmit it, and then how infectious they are. I think you've answered.
Yeah, I think I touched on all 3 then. Yeah, so they can, again, the same transmission that we suspect. We suspect the virus is transmitted by droplets. Can you get it from a surface? Possibly. How infectious a surface is probably a lot lower than just inhaling the virus. So wearing the mask prevents that droplet from getting in the air. If that droplet's not in the air, you can't breathe it in. And I think the 6-foot answer, I think, falls into place where we see that droplets when you're talking to somebody usually fall within 6 feet. However, if you've got some kid that's coughing really hard or sneezing really hard, they can easily pass the 6 feet that we're talking about. But if you've got a mask on, it's not going to go 6 feet. It's going to go about an inch. Okay, so you are preventing the spread by doing that. Yeah, so I think these are, but definitely droplet transmission is what we suspect the virus is doing. And that's why it's spreading so quickly too. You don't necessarily have to touch a person. You just have to be where the person was and be there long enough to breathe in the virus. And if they've been there for a long time, you've been there for a long time. I think the estimate is about 5 to 10 minutes in the same place, 6 feet apart or less than 6 feet apart, you've probably been exposed.
And Manish, a follow-up question that I have is, how are most children asymptomatic?
Yeah, actually, most adults are asymptomatic too. So I would say the vast majority of people, I think for every one infection that we actually suspect, there's probably 10 to 20 that we don't even realize is infected. I think the most recent estimate by, Dr. Redfield from the CDC was that for every infection that we do know of, there's probably 10 others that we don't know. And he felt that that was probably a conservative estimate on his end. So yeah, to imagine how many cases we've already had and then multiplying that by a factor of 10, it really, it can be really eye-opening.
Jane, as Manish was talking about maybe those asymptomatic patients that, we don't catch, is that good news in a way? Is that news good, not just because maybe we're seeing more people build immunity to it, but that the rates of the devastation in death and long-term side effects might be lower when you factor in all those undiagnosed cases that never knew they had it? Should we be hopeful about information like that?
I don't know. I mean, I'm not an infectious disease expert, but I think, and I'm very much a glass half full person, so I would love to say, yes, that's good news. But to me, it's actually also sort of scary news, because even with that, we still have 185,000 deaths in our nation, depending on how you interpret that data. But I think that's probably pretty close. And then not just that, but all the sort of I think difficult to count consequences of COVID, the cancers that were diagnosed late, the people who couldn't get treatment for heart disease because of COVID and because of ICUs overflowing. So surgeries didn't happen for other important reasons. I think, so I don't know that it's necessarily encouraging. I think it's sort of, it makes it challenging because it's hard to prevent the spread when there's so many asymptomatic people running around, potentially infecting the folks who do get really sick and
exactly,
potentially
like
die.
my brother and sister-in-law, exactly.
Yeah,
Right.
yeah.
So I think, it's fascinating, but I think that's like the Achilles heel of the virus, and one of the things that makes it just so hard to catch and to quarantine and to contact trace and to do all the things that we really want to be doing in order to do this, because I think we're still so far from herd immunity, even though we've had so many deaths, and I don't think we want to get there by way of just everyone being exposed.
Yeah.
And I want to add, Sarah, with death certificates, I just want to clarify for everybody, I really do think that there's an underestimation of the number of deaths from COVID-19 as well.
Agree.
Fill out a death certificate as an oncologist, especially as an internist when we're in the hospital. If they died of respiratory failure, number one, it says respiratory failure. Or if they die of cardiovascular, of an MI, number one will be MI. Then the second is what caused that respiratory failure.
Right.
Be a pneumonia. And what caused that pneumonia? Number three would be COVID-19. So the cause of deaths as the numbers, they're only picking up number one. So, so if COVID-19 is on the first blank, then it's counted. If it's on the second and third blank, it's not counted because it's not considered the primary cause of death. So you have to be careful when you look at the numbers of deaths from COVID-19, because I expect the numbers to be much higher if we added number 2 and number 3.
Yeah.
Respiratory failure, what caused their heart failure? It could have been the pneumonia from the COVID-19, which is number 3.
Right. No, definitely. Christina, I'm going to ask you this kind of just broad-based. Right now we're talking about, our kids and the importance of socialization. And, you mentioned that this was something that, you were noticing. Mental health across the board, young kids, teenagers, young adults, college kids, us, I like to call us not old people yet, but oldies.
Young adults.
Old souls.
I'll just call myself a geriatric, okay?
I'm octogenarian if you're geriatric. So mental health, are we giving enough focus on how we're going to be living, hopefully past this, how people are going to be getting past this? I really do call it post-traumatic stress. I personally get seized with terror if someone comes close to me and they're not wearing a mask. There's no like rational, okay, this is probably fine. If someone's not wearing a mask and they come close to me, I almost have a visceral, physical reaction to them to be like, get away from me. So I guess I'm asking, are we spending enough time with our kids, with each other as families, talking about how are you feeling right now? And what can we do as a community to kind of help us all manage this better?
Gosh, that's such a layered question. And I think that, well, first, as a society in general, we probably give mental health not as much time, effort, mindfulness as we should. I mean, there are data to suggest, domestic violence, child neglect. I mean, the economic strain that this pandemic and the subsequent lockdowns has had on some households, definitely will have, potentially lasting psychological effects that we're just barely skimming the surface of. I think that, I too see myself as kind of a glasses half full person. So, even within our family and communities, one of the silver linings of not being able to go anywhere is a lot of quality time together. And so, family date nights, cooking more at home, doing quiet time things together more so than just being shuttled to and from activities, which tends to be the frenetic pace that all of our lives have, day to day typically. That was a positive in a lot of this. A downside that I think was necessary for safety and something that I still wrestle with is, some of the isolation, particularly with our facilities. I have an elderly grandmother and other family members who are in facilities like nursing homes, for example, and they remain on lockdown. And that's definitely had a psychological toll, not just for the emotional, but for folks who have kind of cognitive issues and early dementia just due to the lack of routine, lack of human contact. And I think that's something that really hasn't been explored. And even just kind of existing in-person interactions, but with more social distancing, just in my role as an oncologist, there's a human side to being able to comfort a patient with a bad scan. And a lot of that is lost in the telehealth venue. And even just a lot of kind of the communal spirit that can happen in some of our waiting rooms, for example, infusion centers, has really had to be pared down to kind of minimize clinic numbers and minimize throughput. So I think there's a potential for innovation in terms of even forums like this to kind of bring people together through telehealth, through Zoom, to try to, make those connections, to try to grow from the social media movement, to try to make those connections. But at the same time, a lot of the human interaction and things that were done very casually are gone. And then we've really had to rethink things, especially for our youth, especially, with disruption of activities in school and that sort of thing. And I still think we haven't really thought through how to resume that for our elderly and our nursing home population. So I think at least being aware of all of these issues and kind of bringing that to the forefront as we also think of the infectious risk, just that psychological morbidity. But I don't have the answers. I wrestle with this every day, both in practice and as a family member, as a granddaughter, as a caretaker, in so many ways.
Yeah. It definitely is unprecedented for us. I mean, it's just the whole world is battling with how do you get back to some semblance of wholeness. It's not even normal. It's like wholeness. How do we just get out of some of the dark places that we find ourselves in when making decisions about sending kids back to school or about taking medicine or, all of you are facing with treating patients every day. Just that hopefulness that we can figure out, the next steps and that those next steps feel like we're moving in tandem, which is just another conversation because so many of us aren't moving in tandem. And I do kind of think that that's because there are so many mixed messages around this. So again, it's one of the reasons why we wanted to pull all of you together. Heloisa, this breaks a little bit from back to school, but I know this will resonate with you, and it's something that's just kind of like been laying on my heart so much. You know, we just lost Black Panther, so everyone who has kids is keenly aware of Black Panther, Chadwick Boseman. I fear, and the data backs up these fears, that there have been so many delays in standard screening. And so for all the parents listening right now that have said, you know, I'm not going to prioritize this screening, this mammography, this pap smear, this colonoscopy in this moment because there are too many other things, too many risks, too many decisions I'm making. Heloisa, I'd like for you to just talk to us about what early diagnosis in colorectal cancer means for outcomes, and why it is not just important, it is essential as a parent listening that you schedule those screenings. Because if you think you're making decisions about your kids with their best interest at heart, your life is their best interest at heart. So Heloisa, if you would talk a little bit to earlier onset and why it's so important, vital for people to get back to screenings.
Yeah, no, thank you. This is an excellent question and something that we should highlight. I do GI, medical oncology, so I see the patients with colon cancer, and colonoscopies can really save lives because you can detect pre-malignant lesions, or take care of them before they turn into cancer. Or you can already detect the early stage before metastasize, or before you goes to lymph nodes, and the risk is much higher. So absolutely, I don't think, especially now that we have all the safety precautions in place, and most of the places are really putting very strict safety precautions, we shouldn't stop anyone from doing a screening test or scans if they are due for scans. I think in the first few months, which we really didn't know exactly what we were dealing with, it was a different story. But now that we know how to be cautious about it, I think we all should, and to continue this. And if it makes it, and I'm a preacher of do what I say, blanking on that. I'm actually driving my husband for his screening colonoscopy on this Friday.
Very good.
So that tells you that I take this quite serious. That has been scheduled probably about a month ago, and I just told him, look, you are 50 years old. You can't push this. This is really important because I want you to be here for our kids.
Yes.
And so yes, so I'm doing it with my own family. So
good. So you're hearing it from the experts. I mean, we've got a GI oncologist, go get your colonoscopy. We've got breast cancer, radiation oncologist, and medical oncologist, go get your mammogram. Director of women's health at Moffitt, go get a pap smear. Stop delaying. Nobody wants a pap smear. I can attest, nobody wants it. You have to schedule it. And I think it's something that's really been laying on my heart. Okay, well, normally I end with something really high-spirited and silly, but I actually want to end with around the room with a sentence. We heard early on that 100+ years ago, the Spanish flu did almost exactly what is happening right now when we look at those old pictures. And I can tell you, until COVID-19, I didn't know about the Spanish flu and what it felt like and everything, because why would I know about that? I want each one of you to just give me a sentence, a headline or a sentence that someone says 100 years from now about us going through this. And it can be something funny and silly, or it could be something serious. It could be a wish that you have for this generation experiencing COVID-19, but something that you think people in 100 years will look back and say about us going through COVID-19. Manish, I'm going to start with you. You're on mute, sir. That's what they're going to say, that these people, you're on mute 100 times.
I think I would say how masks save the world. I think simply put, I think that's really what we're going to come.
I love that. I really love that. Okay. Jane, can I go to you?
Sure. I think in my glass half full style, what I would say is I hope that what happens is that people look back and say this was a generation defined by resilience, that we met the challenges that we're faced with and came up with the best possible solutions in a really difficult time. That I hope that they say that about us, and then of course, and even more so about our kids' generation, as they're forced to do so many things differently, school, sports, friendship, learning, that they rose to the challenge and that we hopefully, come through this stronger.
Thank you. That's beautiful. Thank you so much. Christina?
I guess in that same vein, there's a set of children's books called She Persisted that talks about, kind of women who changed the world. So maybe it'll be something along the lines of we persisted, kind of through all this adversity and we're able to rise to the other side.
Thank you. Thank you. Heloisa?
I think 100 years from now, hopefully we'll look back and learn that we shouldn't be selfish, and we were able to put together the large medical community to move big efforts together. Databases have been created, clinical trials, studies have been put together so quickly. So this is, I think we'll look back and say, this defines that if we put your heads on it, we can do it quickly.
Thank you. Thank you. And Roohi?
I would think I would like them to look back and say, even though they were in isolation, they were never more together.
That's so beautiful. Thank you. I appreciate all of you doing this. It was short notice. I wanted to just pull together the best and the brightest women that I admire for your decision-making ability in your careers, with your family. And Manish, you were a wonderful bonus.
Oh, no, I totally owe all of you an apology. I am so sorry that was late.
No, not at all. Not at all. We know that we're balancing so much right now with life. And so just the fact that everyone thought this was important enough to get on and share with other parents that are going through very similar.
So you're not going to yell at me when I'm late at your appointments now.
No. And I just thank you all for your time here with us. And I know that it means a lot to our listening audience to have each one of you share from your heart, from your family, and from your informed decision-making directives and the things that you've done. So I look forward to a time where we are all together again. I pray for each one of you and your family members, all those kids in, out of school, virtual, in front of the computer. I know that one thing that they share is that it is very different times. And so I thank them. I thank the kids for their resilience, and I thank you for your resilience and your time. Thank you again so much for being with us.
Bye-bye.
Thanks for having us, Sarah. This is great.
Bye-bye.
Thank you so much.